I had the honor of presenting the lunchtime symposia on Friday about NMOSD, and we did talk briefly about interdisciplinary management of NMO. I think that as the disease has come more to the forefront, not necessarily because more people are being diagnosed with it, but because there are three FDA-approved therapies for it now. There are several patient advocacy organizations, and the knowledge about the disease is just spreading. And people living with NMOSD typically are more disabled than people living with MS, and their symptoms are more difficult to manage. So their pain is much worse. Their bowel and bladder issues are much worse. Their vision issues are much worse. And so this often leads to the need for a bigger toolbox, whereas a person who has MS and maybe has a bit of a bladder issue might be managed in the neurology clinic. A person with NMOSD might need to see a urologist and a gastroenterologist, might be catheterizing earlier. And so I think there is a need to talk about that early to a person living with NMO, so they don't feel overwhelmed that they might need another specialist on board. I also think that, just a shameless plug for nurse practitioners and physicians' assistants, I think that they are well armed and well educated to treat some of these more difficult symptoms prior to a referral, and that makes them an asset to the specialty clinics for MS and NMO care.